Let's get right into it. You're watching The Last Word. I'm Sanjana. Pandemics, viewers, are not just a medical phenomenon. They affect you and me. They affect individuals. They affect the society. As Tanvi pointed out, they affect the economy. All of this on many levels causing disruptions. And tonight we're going to broach an issue that is extremely significant. The emotional impact of the coronavirus. The forgotten, the often ignored but niggling feeling at the back of your mind. Is what's happening normal? No. But is the anxiety, the panic and sometimes the fear that you're feeling normal? Yes. Are you in this alone? Definitely not. So starting tonight, we're going to address one important mental health issue and one facet because of the coronavirus and understand how we can do better. We can understand how in these times of social isolation and quarantine, we don't necessarily have to lose touch with others and most importantly ourselves. So if you have questions about your mental health or just want to call and share what you're feeling, I urge you to. There is no shame in what you are feeling, and knowing more and talking through it will only help. So we've got an expert panel lined up who are going to take us through every aspect that could be upsetting us mentally and how to deal with it. Our call lines are open. The numbers are flashing on your screen. So feel free to please reach out. Let me quickly introduce my guest this evening. I have Anand Chulani, a leading success coach, joining me. Sunaina Rekhi, a celebrity yoga teacher and a health and lifestyle expert. She's also represented India at the UN. Dr. Shyam Bhat, psychiatrist and physician. Sheetal Ranganathan, health columnist and corporate leader. Good evening. Thank you so much to everybody for joining us. Dr. Bhatt, over to you first. These are particularly troubling times. We've been trying to address almost every aspect and every possible impact that it can have on different sectors and our health. But I think mental health is something that's important. It's going to stick. It's going to have, the effect way after this has passed. How can we protect our mental health at a time like this?
You know, Sanjana, you're right. This is an absolutely, it's a crisis not just for our physical health, but I anticipate a pandemic of mental illness and mental health issues. Because, you know, what we've learned from our previous epidemics, from Ebola, for example, after Ebola, there was a huge rise in the number of people seeking help for mental illness. A huge rise in the number of people suffering from depression and anxiety. And in fact, a paper just came out recently from China, and in Wuhan, about 53% of people reported significant, that is moderate to severe stress, and about 17% had clinical depression. This is from the most recent, from last month. So we're already seeing that an event such as, which is unprecedented, where there's a lot of uncertainties, creating a lot of anxiety. And we are seeing really broadly, I think you can broadly break down people into three groups. There's one group who's saying, listen, it's not a big deal. They seem to be in denial, and they say, they're trying to cope with their own anxiety by minimizing the danger. There's the other group who's really panicking, and who that kind of panic is obviously not healthy. It can drive them to doing things that are not healthy. And then what we really want is that balance, as you rightly said. We have to understand there's an issue, we have to do something about it. There are guidelines that we can follow. At the same time, it is really important that we manage our mental and our physical health, because that is what will give us immunity. It will give us the power to fight it. And both as individuals and as a society, we need that. So I think the key message is anyone suffering from depression, pre-existing depression or anxiety, they are particularly at risk when a stressful event like this happens. And so if you're suffering from depression or anxiety, you find yourself feeling hopeless, tearful, even suicidal, that's a sign that the depression and anxiety is getting worse because of this situation, and you need to seek professional help. But even for people who don't have pre-existing depression and anxiety, we often see that the first episode of depression and anxiety, clinical depression and anxiety, can occur in the context of a severe life, of significant life stress like this. So we need all the mental health professionals to be available and to be watchful for this, and of course educate people on how they can help prevent this problem from happening.
Absolutely. Dr. Bhatt, thank you so much, for putting that in perspective. Sheetal, during SARS, I believe there was a study actually that was conducted in Toronto a little after that, and they actually discovered that a staggering number, 30% of the people suffered from depression and psychological disorders that stemmed from the social isolation, from staying indoors, the cabin fever. Now, understandably, just like, we were discussing social distancing being particularly hard in a country like India in the last week, that has been something that we've constantly been focusing on, given how we are structured as a society. What do you think India should particularly do for mental health when it comes to the coronavirus? Any tips that are specific just to India?
Yeah, good evening. Thanks for having me. The tips will differ based on which segment of the society we are trying to help here.
True.
Especially, I mean, since I belong to the corporate sector, and people may feel that, at least they are not in existential crisis when compared to people from the lower strata or those who are daily wage earners, etc. So, for them, it would become a calamity if they lose the jobs. But I can just tell you that even in the corporate sector, especially for startups and small scale setups, the impact of an economic recession that is speculated very strongly, or this feeling of anxiety and scare of job losses, positions being rolled up, delayed customer contracts, lack of dream opportunities, for example, for freshers. It's a huge stress that people are going through, especially entrepreneurs who not only are dealing with financial stress, it is also a moral stress because they may hold themselves responsible for taking away livelihoods or future of young fellows. So, if ever, I mean, even for large organizations, by the way, those who have the financial muscle and, they've had enough risk diversification strategies, they might have seen such crises before, as you mentioned, the SARS crisis, or the economic recession before that, in the 2000 and 2002. So they may buttress this blow. So the impact will differ from what we are talking about. And if ever there was a VUCA world of volcanic proportions, it is now. And I must also say that if ever there was a use of social media that could have been put to de-stress or decompress, that is also now, because social media can become a unifier in spirit. People can get into constructive conversations. It will generate a sense of community. It will energize each other. So I think these are the things that people should resort to.
Absolutely. So Anand Chulani, let me quickly say good evening to him as well. He's joining us, a leading success coach. Anand, do you think now that it's absolutely imperative at this point for the government, for the other channels to also release advisories and resources for mental health, that it's equally important along with everything else that's coming out and all the dissemination of the information?
Yeah, I think it's important for the government, of course, to take action and to lead here and to prepare and to give us the right resources. But I think an important point here that's important is right now what we need certainty. Because right now we're in a place where every human being is going through massive uncertainty. And usually human beings are used to uncertainty in their life in some way. They're used to uncertainty at work or in their home. But they're not used to uncertainty in every area of their life at the same time. And I think that's what's happening. And so people are feeling stacked. So, what the government and what our leaders need to do, in my opinion, is a few things. One, be absolutely truthful and transparent with us. Don't tell us what we want to hear. Don't tell us what you think we want us to hear. Tell us what we need to hear. The other thing I would say is also be careful of how information is being shared. A lot of governments right now are saying things like don't panic, don't panic, don't panic. Well, the more I say don't panic to the subconscious mind, that's a command that says panic. So what I'd rather recommend the government to do is say have courage. Tell us what you want us to feel, not what you don't want us to feel. And then the third piece is really, I think, planning ahead and really being resourceful. I love the Singapore government in terms of how they communicate to their people, in terms of really not trying to over motivate them, not trying to pump them up, being honest, being real with them, and then giving them a sense of a plan. And I think right now a big thing is this. Look, it's like children and parents. If you don't know the parents don't know the answers all the time. I don't think we're expecting our government to know every answer right now because this is new. But at least if they can show us that they're working on it, they have a plan for it, that's what more important. Overselling right now actually will create more uncertainty.
Absolutely. And even planning ahead and being resourceful perhaps needs to apply to us when, we're looking out and we're taking care of our own mental health. Sunaina Rekhi also joining us. Sunaina, if one is self-isolating, does it become even more important then to strike a balance between having a routine, making sure each day has some variety in terms of exercise, in terms of meditation? Would you have some recommendations for that?
Yes, of course. I think isolation is a beautiful thing. And but people abroad, I think, are feeling a lot of separation, from the normal things that are happening today. Like for me, I'm exercising. I'm doing an hour of yoga every single day. I'm continuing with my business. I'm continuing with my kids. So it's something, yes, I think it's very important to have a break, but still go on. Otherwise, it affects you mentally, dude. Like, how can you be at home every single day without any focus? So, yes, I think you need to stay busy.
Okay. So, Dr. Bhatt, all of this, as you rightly said earlier, may be taking a toll, particularly on those already living with conditions like anxiety. I mean, for any other person, like Anand Chulani rightly said, that if you're going to say,
OCD.
don't panic, it is may have the opposite reaction. OCD, especially if you're going to issue an advisory that talks about hand washing. What about them then?
Well, I want to just talk about a couple of points which are raised. I think firstly we have to understand that I think Anand mentioned correctly that uncertainty is a key feature of this. The other is novelty. If a threat is new and there's uncertainty, that's creating the threat centers in the brain to really overreact. And the fact is that the government or nobody can give you certainty. This is a new condition. We do know some things, but the degree of certainty that a human being needs to feel safe, that's going to take some time. So one of the things we have to accept is there is a great deal of uncertainty, and people are being asked today now what we have to do is sort of find stability within. Now, I'm not talking about the clinical population. That is very clear. If you have OCD, anxiety, depression, and you're struggling during this time, you definitely need all the professional help you can get. But the key here is prevention. Keep in mind that mental illness is a preventable condition, and we are now seeing a huge, this kind of stress, which has the potential of creating hundreds of thousands of people with depression and anxiety. So how do people prevent? Well, first thing is meditation is really, really powerful because uncertainty is really about the future. And we are the only animal species that faces threat not just in the present, but from the ideas we have about the future. And that's why we plan, and we are, as a species, we are successful. But that's also why we need to learn to manage our minds at times where we don't have enough information to sort of extrapolate, right? So meditation is very key, where you still learn to still your mind, come to the present moment, and then actually, in a sense, this has been echoed in our own sort of traditions in India, where we talk about being a karma yogi. At the battlefield, there is an issue, but what we have to do is do our duty, which is in this case, wash our hands, make sure that we're not taking too many, we're being safe, and keep calm at the same time, and maintain our physical and mental health through meditation, exercise, adequate sleep, nutrition, avoiding substances, and staying connected, not holding up in a corner and feeling that this is your problem alone to solve. We're all in this together, and finding that connection also is of a lot of help. So that's what I would tell everybody, to make sure that you do this every day, to sort of channel all that anxious energy into doing something that you can control, which is managing your health. If you're smoking, now's a good time to quit smoking. If you're sedentary, now's a good time to get exercise. All of those things will empower you and, actually make you healthier.
And especially since you actually have time at hand, so there's very little, leeway or room to actually make any of those excuses that we usually do, that we usually tell ourselves. Sheetal, what about, the ones in charge? I know the WHO has a special set of guidelines just for health workers, mental health, but what about looking out for the people who screen us, who test us, who treat us. I can't imagine that any of this is easy for them. They must be physically and emotionally drained.
True, and this happens quite a lot, not only because of seeing pain and suffering and this enormous amount of uncertainty around, but also because of burnout, especially in India, where health workers are very few as far as the population is concerned. So burnout, which is an extreme physical and mental stress of doing their jobs, and health workers have a job where there is no chance to make a mistake, because a mistake could cost someone one's life. So yeah, it's a burnout plus this entire sadness all around. It will take a huge toll on the health workers community. And unfortunately, especially in India, that is really an issue which has been ignored for long and should be taken up by the government. And if this is one reason to do this, which is the coronavirus threat that we are dealing with, then probably this will become that silver lining around which the policies can be designed.
Okay.
Which would take care of the mental health of health workers too.
Absolutely. And perhaps that is something that, the government also needs to consider when it is, releasing advisories. I'm going to come to Sunaina and Anand now because, understandably, I know, Anand, this is your area of expertise. And Sunaina, I know that you are also a mother. Talking about children, when it comes to looking out for the mental health of children during social isolation, you have a child as well. How are you dealing with this? What about meditation? Are you involving your child in household chores? What ways and means are you using for the child to be occupied so that they don't start feeling abandoned or lonely or left out?
Yes, that's a great question actually. So with my daughter, there are so many activities I'm doing right now. So she's doing piano, she's doing football, she's playing basketball, she's doing everything. Now, of course, because of Corona, we have something in the backyard. So whatever they can do, make the best out of whatever you have at home. I'm planning to do cooking classes with her. But I think more importantly, don't make them so, like, my daughter knows everything about coronavirus. I think when we didn't know everything. I think they know so much because of social media, because of digital, but sometimes it's better not to give them so much information for them to get anxious as well. So it's good to be informed, but at the same time, not overdone, because so many countries are just making up stories now. So it's better to keep your child a little protected from all of it as well.
Okay.
Can I just add?
Anand, I want you to add to that, because what would you say, what is the common behavior or, out of ordinary behavior that is displayed in children that you would pick up on, say, as a parent or as an expert, or just to any of our parents who are viewers who are watching, saying that, okay, my child has started to do this ever since, school's been called off. What would you recommend, to them, or what would be the behavioral changes?
Well, I think two things, and I think it's been mentioned earlier about the need for connection. One of our primary needs is a need for love and connection, and children who have where their number one need is love and connection right now can feel very isolated and very alone. And I think keeping that connect with your child is so important. But also, it's about giving them certainty, like I mentioned earlier, because the child is looking to the parent for certainty, the parent's looking to the government for certainty. So we're all children in some ways, and we're all looking to some parent for certainty right now. And I think the biggest way that you can help your child right now is to teach them to be response able, not responsible, but response able to respond to what's happening right now. And to add to the point, I think it's about helping them. We get to the facts are the facts, right? The situation's the situation, but we get to decide how we're going to respond emotionally to that situation. Right now, your love is not isolated. Right now, your courage has not been canceled. Right now, your faith has not been quarantined. So we can teach our children that it's a great learning opportunity right now to teach them that when life happens like this and there's massive uncertainty, that they can be response able. Because right now our children have grown up in what I call the summer of the world, where the fruits are already there for them to get. They press a button and they get it. It's instant gratification. They haven't gone through a winter, a season of life where we've had to really struggle for it. Now they have. Now this is winter for them. And I think the biggest gift a parent can teach their child is how to be emotionally and mentally strong no matter what season life is in. And the biggest way to do that is to teach responsibility. And it's not just lecturing it, they will watch the parent to see how they're responding.
Absolutely, and what you said is really interesting, because Dr. Bhatt, I was also reading, looking at these reports, and while it is hilarious to have these memes on social media talking about working parents and how they're trying to escape, what their children are doing, or how they're cooped up with their children, or how they're helping them hunt for activities. Do you think that perhaps this is also a time when parents should be particularly, concerned about not, speaking that, putting forth that narrative too much, because this is perhaps a time when your kids need you. They should not feel like you're being a burden, that they're being a burden to you, or that, they're being a headache at that point of time.
Well, Sanjana, I think the children of today, because they have access to so much knowledge, they can give you the impression that they have developed beyond their years. And in fact, they haven't emotionally. Emotionally, the child of today is like the child of yesterday. And that's something we shouldn't forget. So the child of today is, however, burdened by knowledge. I mean, we could be kept in relative ignorance when we were young because there was no internet, there was no social media, people weren't always, but today's child, look, there's no way. Or let me put it this way, if your child is school-going age and they're reading and they're watching, they're going to hear some news. What is really important, though, is they're sensing how you're feeling emotionally. It's not about logic, and a lot of parents, I think, get caught up in the logic of the thing. What is really important is, can you convey an energy of safety and relaxation, of feeling that, listen, I got this. Now, even if you don't feel that, I think as a parent, it's really important for you to meditate, for you to say, listen, I'm doing what we can. And so to exude that confidence is really important for the child. More than anything we say, that's really, really, really important, So I think parents can spend this time, firstly, bonding with their children. I think one of the things is, in many ways, this has made us, the whole world had been moving so fast. And, I'm not saying this is a good thing that happened, but every bad thing has a sort of something we learn from that. Every period of suffering for the individual and for society and for the entire world is also a period where we learn something. And I'm hoping what we take from this is resilience, empathy, connection, and a little bit of collective, let's just get our priorities right as a world so that this doesn't happen, and that we raise children in a better planet. Because that is tragic, actually, to see that children today in many countries and maybe in ours as well have to restrict themselves, So I'm hoping that this will start something, and shape the world in a different way for our children.
Absolutely. I think, Dr. Bhatt, you've really hit the nail on the head in the sense of, perhaps having a fresh perspective about this, because, at the same time, we have to consider that, this is perhaps a time for all of us to put our phones down, maybe really connect with our families, do some yoga. I'm sure Sunena would agree with that. And, really get to know each other and go back to the basics, go back to what felt good, and, kind of just nourish each other mentally. Sheetal, I think it's also important for some to not treat this like a vacation, because that's what you can get thrown off with the abnormality of this. Like, I believe that can perhaps affect your mental health. I mean, given a choice, I would love to switch Netflix on in the middle of the day, not get off the couch. Yes, but is that going to be good for me if social distancing is here to stay? No. Would you agree with something like that? Or would you also say that perhaps at this point, even what you would really, be desiring to do, you should go ahead and do?
I would say, right now, the kind of uncertainty and the first time situation that people are in, if Netflix gives them some pleasure as a break, between the work hours, and they have the flexibility to do so, it's fine. And, I could even go back to the previous discussion that we were having with the panelists about children. So, what about, so for example, my child is a teenager, and teenagers have to be handled very differently. He's still to be called a child, but the level of, change that this social distancing and isolation is bringing to the life is just too much. It's very difficult to manage someone who asks a lot of questions, who is well read, can make opinions at this age. And my mind just goes to the film that I saw long ago, A Beautiful Mind, where the father dealt with it so tactfully and so beautifully, making a World War situation into a game. It's not possible to do it with teenagers, but for a younger kid, yes, it's something that we can design and manage properly.
Okay, so let me quickly now ask about another demographic, but before that, I just want our viewers to know that our call lines are open, the numbers are flashing on your screen, so if you have any queries and any questions and nothing is silly and there's nothing to be ashamed of, please feel free to call in. We have a panel of experts sitting here and we're going to be fielding your questions to them. If nothing, if you just want to talk about how you're feeling, please go ahead. There's nothing to be ashamed of. We're all in this together. Yes, we're all many feet apart and socially isolated, but we're definitely not alone. Anand Chulani, older people now, they are more at a risk of this, because of coronavirus. But at the same time, they're less technologically savvy. They may have fewer connections to even begin with. They might not be able to video conference or even send a text message. Now, this becomes equally important then to reassure them that help is at hand. So how would you recommend we do something like this?
I think a couple of things. I think, first of all, we are talking
See, one
about
though, I think with
technology.
Corona,
So, Naina, I'm just going to come back to you. That question was for Anand Chulani. I'm just going to take the next question with you. But Anand, go ahead.
Sure, no problem.
okay.
I think the main thing is with elderly people. Look, my grandmother is in Mumbai right now. She's 86, and I'm struggling to keep her in the house. She wants to go out and she wants to socialize and she wants to meet people, and I'm telling her literally, the kiddie parties can wait. Right now, you got to take care of yourself. I think the biggest thing, there's something about elderly in some ways that them not being flooded by TV, flooded by social media, actually gives them some freedom. I think one of the biggest things right now for elderly, but for all of us, I think is one word, and the word is future. I think right now we cannot see beyond here. We're in survival mode. And I think right now, if we can get ourselves and lift ourselves above the clouds, lift ourselves above what is right now in front of us, I think that is the greatest thing. And for elderly people, that's not easy because they're looking at their life and saying, what else do I have to look for? And I think the biggest gift you can give any elderly person is give them a compelling reason to live. Give them a future to live for. If they have a compelling future right now, that will give them the strength, that will give them the motivation to take care of themselves. Just saying take care of themselves is not going to do it. You have to give them the why.
You wanted to add something to this? Go ahead. Okay, I think, Sunena, if you can hear me, you wanted to add something to this? Go ahead.
Yeah, hi. No, I'm just saying, I think so much gratitude that it's not affecting the children that much. You know what I mean? Like, that's still very mild. So I feel like Corona has kind of just saved the kids a lot. I think the mild version is happening. So that's, touch wood, that's God's grace as well. And also, I think another good thing that Corona has brought, like today, look at the healthcare. We don't have enough masks. Imagine we were fully prepared. So I think healthcare needs to kind of buck up because everything is great with healthcare when everything is fine. But as soon as something has gone down, it's not able to supply. It's not like we have one big factory supplying everything in terms of need. So I think it's been a revelation to kind of upstep the healthcare game as well through this virus. I think this is the 7th virus, and we're not prepared for this. So,
Okay. You know, Dr. Bhatt, you wanted to add something to this? Go ahead.
Yeah. Yeah. Look, I think, one of the underlying reasons for this anxiety and panic is something that is, as I was saying earlier, is uniquely human. As therapists, some of us have what we call an existential sort of perspective. And an existential perspective basically means that, we are very aware that as human beings, we always have a sort of awareness that we are not here forever. Now, that's a uniquely human thing. I mean, other animals evade threat only if it's in the present moment, but they can't contemplate their existence and mortality. And what you're seeing now is, although obviously the mortality is thankfully low, higher than the influenza, no doubt, something we should take seriously. But at the same time, while the individual might be at low risk, it does awaken thoughts of one's own mortality, of existential questions. And this is affecting both adults and children differently. You see, for the first time, a child, although we are trying to protect them, has to be warned to not go near grandma because that could result in a very bad situation. So, we want to prevent children from feeling guilty. We want to make sure that at the same time they're responsible. We don't want them to sort of start worrying about their own death and own mortality. So a lot of sensitivity is needed within the family also to handle these issues, and many children will have questions about this, and that needs to be addressed by parents. And of course, like I was saying, a lot of adults also will have this, will start thinking about their life and priorities in their life, which direction it's going. And not all that introspection is bad, as I was, some of that is actually good for us to do.
Absolutely. And I think one is also hoping that perhaps the reassurance comes from, even the government. We understand the Prime Minister is going to be addressing the nation tomorrow on coronavirus. I think this is expected at about 8 o'clock in the evening. So, I think all of us are going to be watching and waiting and also hoping for some good news or some ray of hope, really. Anand Chulani, let me quickly come back to you. Do you think then, using what, of course, Dr. Bhatt has been saying, do you think that then businesses, government, public health, medical sectors, to parents, families, teachers, perhaps they need to adopt calming strategies, for their constituencies, for their team members, for their employees, for their families and the students, because, I'm sure companies are probably saying work from home, but is that really enough? Do you not need to, go beyond that and reassure? Do you not need to perhaps tell patrons of your restaurant that you have nothing to worry about? Besides, of course, the staccato "don't panic," phrase that everybody has grown to like and use often.
So again, it comes down to what Dr. Bhatt and I both said, which is about giving certainty right now, right? And and certainty is important because your job is not to tell people what to do right now. Your job is to influence them. And the way you influence them first is to be influenced yourself the right way. And what controls how we're influenced is one word: meaning. What is the meaning we're giving something? Right now, you could be turning on the news for many reasons, but I'll tell you right now, go to the news to collect information. Don't go to the news to collect fear. There's a big difference. And if the meaning you give something affects everything right now, I call it to prepare. Pair, P-A-I-R. Pair as if it's like pairing something with like Bluetooth. You're syncing something. How do I sync the meaning in my mind to the events happening in my life right now? And I think that's what every leader in business or government or family needs to do, is create an empower meaning right now. Like you said, this could be the moment where you say, I cannot connect with anyone, I'm alone. This could also be the moment you could say, I'm going to innovate my business and find a way to grow. Right now, I'm sitting here in London and I'm writing my book, I'm developing online products. Use this time to strategically innovate. Use this time to grow your family connection. Use this time to be present in the moment instead of being scared. Use this time to build emotional muscle. What is the meaning you're going to give this time? Because this moment in life could be one of the scariest moments in your life, or could be the moment where you built the most muscle. I've been through the Ebola virus. I was in Africa during that. I was in Nepal during the earthquake. And I'll tell you something, the meaning I've given in my life is those moments made me more of who I am. And I know everyone I'm talking to right now, if you can feel my energy and feel my heart, I know you have the strength in you. The certainty you need is not on the TV. The ultimate certainty is in you. And if you can tap into that strength, tap into that certainty within yourself, you'll be able to respond to things differently.
Absolutely. And perhaps that's the right message and the right perspective, the way to go about it. Dr. Bhatt, I'm sorry to cut you off, but before I come to you,
Right.
we have a caller now joining us, Shantaram, joining us from Bengaluru. Good evening. Thank you so much for joining us on The Last Word. Go ahead, please.
Yeah. Hi, good evening.
Good
My
evening.
question is, I would like to know if one get infected and gets cured, is there a possibility of getting this virus back? I mean, relapse?
Okay, Mr. Shantaram, we're particularly taking questions and queries regarding mental health. So I suggest if you have any questions on that, then perhaps our panel will be better suited to answer those. Do you have any queries regarding that? Are you feeling anxious, or do you know somebody else who needs, help psychologically because of what's happening in the country with regards to coronavirus?
Okay. In that case, my question is, how would one need to cope up if if we were to do a self quarantine?
All right. Okay. Sheetal, would you like to answer that question?
Sure, and I can, take a stab at the first question also,
Sure,
give a very
wonderful.
short answer to it.
Wonderful.
So far, so far there have been very few cases, and when I say very few, these are, as low as less than 10 cases where reinfection has been reported, for example, from China. So if treated and managed in a proper way, in isolation and keeping self-quarantine and taking the doctor's advice of maintaining hand hygiene as well as, surface disinfection, etc., then the chances of reinfection are very low. So, however, this is a point which is still to be observed because this is the first of its kind situation that the humanity is facing. Now, coming to the second part that you asked, which is how to manage quarantine at home. So, I would rather concentrate on the mental and the emotional aspect of it, rather than the technical aspect of it, which I'm sure is known to many people now, because a lot of information is spreading all around as to if one has to self-quarantine, what are the best practices to take care of. But in self-quarantining, I think that's the challenge both for the caregiver as well as the patient. Patient, of course, is feeling extremely helpless, a new kind of an infection, what would happen, as well as worrying about the care provider, that, will I be, the reason to be passing it on to my family, etc. So that can lead to a lot of mental stress. And similarly for the caregiver, not only the stress of managing illness, which is very uncertain right now, as well as, care for self. What if I catch the infection and I become the next, contact to spread it further? So in both the situations, I guess, one of the co-panelists talk about doing some self-introspection as well as finding a purpose to get oneself busy, because in this situation I cannot say that connections will help unless they are virtual, which is quite possible. As of today, we can do video calls or get connected with like-minded people and friends who can keep us more pleasant and in a better mood. But an empty mind can become a devil's workshop, so it is great to find a purpose to associate with, read, watch Netflix if that gives you, some sort of peace, or do anything, draw, do whatever. And the second point I want to do is practice gratitude. There are things could have been worse. So if one has that perspective in mind, where one really, considers his or her own situation with respect to what could have been, which was worse, then you suddenly start becoming more practical as well as, thankful.
Right.
That at least I know what I have and now I can work towards it.
Sheetal, thank you so much for answering that and really putting it together so beautifully. We have another caller now joining us on the phone line. Vincent joining us from Mumbai. Good evening, Vincent. Thank you so much for joining us on The Last Word. Go ahead with your question,
I
please.
love to see Mirror Now every time. That's my favorite channel.
Okay, I'm glad.
Okay, now this is actually all this chaos which is running about. My opinion is that it's a blessing in disguise, and this is a time to work on our emotions, strengthening our growth, and even I would instead of panicking, there are a lot of much things that this is a time when our generation will learn how to cope up, how to grow in this situation. And this is, I feel this is a blessing in disguise where we will overcome and we will have another step to go ahead. And especially for the young generation, I feel that this is an opportunity for them, not a panic things, but to work on it and to overcome it. This is a strength actually to build up emotionally, spiritually, and even physically, even financially, because the situation which is going on. And my last message for the whole our country or the world, coronavirus doesn't have any religion nor any caste, okay? I would urge every politician, every people, this is our enemy. Health is our concern. And the best, the betterments of the humankind. This is how we will make a world a beautiful place to stay. This
Absolutely.
is my...
Very well
Yes.
said. Very well said. Thank you so much for calling in. Dr. Bhatt, we're getting calls here, of course, people asking about the best way to, cope, live better. But if I were to be somebody, who's never done this before, understandably, like a lot of people, and by this I mean, gone through something as psychologically intense, what is the best way for people who have never talked with a therapist to find the help they need during this time?
Well, what we need is the quality of resilience, right? The ability to bounce back from something that is difficult and to actually grow from it. And I think there are a couple of things. I just want to touch upon a couple of, tie them together. One of the things, for example, if you're in quarantine, one of the things that people are, or if you're self-isolating for that matter, one of the things you're trying to deal with is how to be okay with yourself. I think we are a generation where, especially the younger generation, if I may say that, where, where all alone time is occupied with devices and so on and so forth. And I don't think we are accustomed to solitude. And solitude is different from loneliness.
Right.
That's one of the ways in which you can get something positive out of this difficult time. Now, another key quality for resilience is actually the ability to have faith. And this has become very difficult as we have sort of developed as a society, as a species, and as we know more and more in science. I think it's much more difficult for us now, contemporary people, to have faith. And faith has been proven to be actually very, very strong. And it doesn't matter what you have faith in, whatever your belief system is in, it doesn't matter. The fact is that to think that you have control and you are going to have to solve this problem by yourself is extremely stressful. So to know that you're not alone, that there are people, a whole society working on this, that you can do your bit, and to have sort of faith in sort of a higher power, in whatever you believe in, that can sort of take you out of your own, the sort of overthinking that happens and give you strength. So resilience, which is the quality to bounce back, can be developed during this time. Cultivating optimism, cultivating empathy, gratitude for what you have. All of these are things that we must practice. Now's the time we must stop and say, listen, all this while we've been teaching our children everything in schools except this. We've never taught them in schools. How are you going to handle a very stressful time in your life?
Right.
And, like many of us have said, this has happened. It's unfortunate. We don't wish it on anybody, but let us see if we can use this time to make a change in our educational system and to maybe even to look at the way we parent, so that we understand that, raising our children's confidence, giving them the ability to bounce back, these are things that they really need to learn. And now's a good time to learn. As our caller pointed out, there's no doubt that this is a really good time to learn all of that.
Absolutely, and perhaps this is the new normal. Sunaina, considering you work with a lot of people who are obviously very particular about exercising, you are a yoga teacher. For a lot of professional, collegiate youth, athletes particularly, or people who are very used to getting any kind of activity or exercise, this has been really jarring. With the cancellation, with the postponement of sporting events, with seasons. So how can athletes then try to maintain a good mental state during this time?
I think, I mean, the thing is meditation. It's a lot. I feel pranayam, I feel that if you start doing a lot of breathing stuff, it's going to create a lot of resilience in your body. And another thing, yeah, nature is really good. Nature is not giving us corona. Like, there are places where you can just go into the forest, go for a run, go get some air. I think those, if you can do that, if there's something close by which is empty, like get out a little bit. I wouldn't say like you need to be in the four walls. If there's a place which is quiet and you can have some nature, I think mentally that is really important. Because to be cooped up in one place is easier said than done. It's not easy. So like for us as well, like I am going to a couple of friends' places who also have children, so we are doing a little bit of the play dates. It's not like I'm completely with my daughter inside a house and I'm not getting out at all. I am getting out a little bit. Otherwise, like for me as well, it'll get too much. So I can't say that it's okay to be in the house 24 hours. We are social creatures. Suddenly we're not social anymore.
So, Sunaina, let me ask a follow-up question.
So I can't talk that much.
If I were
to Sunaina's point,
if I were to actually,
Yes,
just a second, Dr. Bhatt, if I were to actually, be somebody that's just starting out, what resources would you recommend? And more importantly, do you think influencers such as yourself should also start, I know that's happening a lot, also start putting out more content, more advisories like that help people that, it could be a smallest thing like a home workout. It could be the smallest thing that, today I ate this and this actually really helped shift my mood, or I tried this recipe. Do you think that needs to be happening more and more encouraged?
I think that's always encouraged. I think it's always nice because suddenly when you post a video, it doesn't matter how many people are posting it, but that particular person could just see your video and it could help. So I think yes, but also the internet is completely packed. It's like whatever we are saying, people are already, because this is a survival, people need all the information that is available to them. Everybody knows if I switch on the internet, that's all that's coming up. There's nothing else coming up. Even cancer patients are waiting so that coronavirus patients can be seen. Everything else is on standstill except this. So I feel that there is already so much information that you actually need just better energies around. I don't think it's more about information, but it's about having energies, whether they are online, which are more positive, which are more caring, which are more nurturing energies, rather than energies which are explaining, okay, let's do 5 poses which will help you with corona. I think that's already done. They'll already get that information. So I feel that for me, I would rather give them something else. I would rather let them relax. I have not spoken that much about coronavirus. Like when they come into my account, they don't need to see so much coronavirus everywhere.
Absolutely. I think that's a very different and a refreshing way to look at it as well. Dr. Bhatt, real quick word from you, and then I'm going to wrap up quickly after taking a question from Anand Chulani. Go ahead, Dr. Bhatt.
No, I was just, responding to what Sunaina was saying earlier, which is that we, Indians, psychologically are a collectivist society, unlike the West, So that's how we think, that's how we operate. We are a part of the fabric of our society, more so than in the West, where they are a little more individualistic. So social isolation for us is much, is going to be a completely different ball game. It's harder for us, there's no doubt about it. And so we have to sort of find a way of staying connected using technology. As much as I say bad things about social media and the sort of, the effects it has had on young minds, there's no doubt that now in this time of isolation and quarantine, this is the way we need to sort of connect with each other. And that's very important for everybody, of course, globally, but particularly for us in India, I think.
Absolutely, Dr. Bhatt. I'm sorry, I wanted to take a question with Anand Chulani, but unfortunately, I'm completely out of time here. But please, our panelists are available. They have website, they have resources to. Please feel free to reach out to them. If you do need any kind of reassurance, and more importantly, if you want to talk or if you want to understand, whether you want to speak to somebody, and more importantly, you are not alone. There is distancing, there is social isolation taking place, but you are not definitely alone, because everybody is going through this, and we're all learning, and we're all trying to understand this new normal and how best to power through. Thank you so much for watching this evening.